beware if you're thinking about joining Medicare and Social Security at the exact same time. There are 5 important things to consider when deciding when to draw Social Security or Medicare. And in this video, I'm going to talk about what those 5 things are so that you can avoid costly mistakes. I'm Emily with the Medicare Coach. We are the leading independent Medicare consultant helping our clients across the country easily navigate the Medicare rules and insurance company options to protect their healthcare rights as well as their financial savings. Medicare can be great if you do what's ultimately right and best for you. But again, we are not an insurance company, an agent, or a broker, so you'll be hearing me say very different things in this workshop. If you want more inside tips to Medicare that the insurance companies don't tell you about, click the comment section below and get those inside tips. So, what are the 5 things to consider when it comes to deciding if you should join Medicare and Social Security at the same time? The number 1 is your priority, okay? When it comes to Medicare, there's a reason for joining Medicare. And when it comes to Social Security, there's another reason to join Social Security. The reason why people join Medicare is for healthcare reasons, right? Medicare rules say by the time you're 65, you either have to be on Medicare or on an employer plan that meets Medicare rules. So there's a very specific criteria as to why someone joins Medicare. On the other hand, Social Security has different reasons, different priorities, right? People tend to join Social Security or draw Social Security for income purposes. So some people might draw Social Security before Medicare. Some people might draw Social Security after Medicare. But the thing is, they have different purposes. So if you assume that you should join Medicare and Social Security at the exact same time, it's usually the wrong decision for most people. And again, it's because there's different priorities for each of them, and therefore most people will join Medicare and Social Security at very different times. But please be thorough and thoughtful around what's important to you and when to trigger each of those government events, okay? The second thing to consider when trying to decide when to start both programs is the qualifying age. You are eligible for Medicare at 65. Now, there are some cases where you can join Medicare before 65, but most of you are eligible for Medicare at 65. On the other hand, Social Security has what it's called its full retirement age. Depending on how old you are, it's likely going to be 66 years and a few months. So people oftentimes get confused and say, well, I can't join Medicare until 66 and 6 months. And I say, no, that's not the case, right? Medicare has different qualifying ages than Social Security. Now, yes, you could draw Social Security before your full retirement age, but you're not going to receive your full benefit. So an important thing to consider is what is the qualifying age for both of those benefits and which one makes the most sense for your situation. Now, the next one's penalties. Again, Medicare has penalties that says by the time you're 65, you must either be on Medicare or on an employer plan that meets Medicare rules, otherwise you'll be penalized. On the other hand, Social Security has different rules, and it's mainly around 1, drawing early, drawing before your full retirement age, and 2, around income that you earn before you reach your full retirement age and you're drawing your Social Security benefits. So people oftentimes get confused too, and they say, well, can I join Medicare if I have X amount of income? Absolutely. Your income that impacts you on Social Security does not have the same penalty implications as on Medicare. And so again, there are different rules around incomes and how that impacts your benefits, okay? The second one is, are you still working, right? If you're still working, you will likely be delaying Social Security until at least your full retirement age. And you may or may not be delaying Medicare, and that'll be based on what your employer health insurance looks like, okay? So again, there are different factors around how working or not working impacts whether you draw Medicare and Social Security together or separately. Again, most of you will be drawing Medicare and joining Medicare and drawing Social Security at completely different times, okay? And the final one is what do, right? If you decide to draw Social Security before 65, you will be automatically enrolled in Medicare Part A and B. And that does create some issues with some people, okay? But if you are not drawing Social Security before 65, you will not be auto-enrolled in Medicare Part A or B. So Social Security and Medicare are different. The only way that they're tied together is really through this if you're drawing before 65 situation, and also if you're drawing Social Security, your Medicare Part B premiums will come directly from your Social Security check. The key thing is this, okay? While Medicare and Social Security can look similar from the outside, they are very different programs, and they should be thought about independently. And there will be a very small percentage of you who will join Medicare and start Social Security at the exact same time. But for most of you, it will be completely separate. So please be thoughtful. Making the wrong Medicare or Social Security decision can have huge cost impacts as well as healthcare impacts. So it's important to be thoughtful around your decision and be thorough to do what's ultimately right and best for your situation. If you found this video helpful, go ahead and give me a like. And again, make sure you look at the comments below to get extra resources, including our free live workshop and extra goodies to, again, help you get the shortcut to Medicare to make your life simple and easy.